Welcome to Smart Health One-on-One. Thank you for joining me on this brief system overview. Smart Health One-on-One is a remote home patient monitoring platform designed for the management of chronic conditions. The user interface we're about to explore contains information in regards to patient monitoring. I took you back to the screen that we are at the user level. If you remember, in the user menu, you have the option to start a patient monitoring mode. You simply click the patient monitoring mode, and then you have a choice between remote patient monitoring or chronic care management mode. I went ahead and clicked remote patient monitoring. The time has now started and the session has begun, collecting the time spent on this individual patient. If you remember, there's some additional information that has been released in regards to patient monitoring. RPM now reimburse for CPT code 99453 a $21 reimbursement for providing patients the individual app and also the individual devices and doing patient education for them about those devices in regards to patient monitoring. There's also CPT code 99454, which is a $69 reimbursement for a doctor to have software that will give them real-time notification and give them also the ability to see real-time data in regards to remote patient monitoring. The last one is CPT code 99457, which is a $58 reimbursement for a clinician and their staff members to be able to carry a 20-minute session of remote patient monitoring. And that is actually non-face-to-face. It can be reviewing patient charts, graphs, and data, viewing their exceptions through our menus, collecting notes that they've seen on the data that's being collected on the patient. So all that, the 99453, the $21 is a one-time fee that is done for that patient education. But the remaining two, which is the $69 and the $58, can be an additional reoccurring monthly of $127 that they can get in reimbursement per patient. That can be, if tallied up for the year, $1,524 that an individual doctor can receive for the reimbursement of those two RPM models. And again, RPM is only one chronic condition. Smart Health One-on-One focused very strongly on making it very easy to review the readings that are being collected by the individual patient, to be able to see the exceptions at a user level. So at any time, I'm going to go ahead and stop this patient monitoring session. And if you remember, everything is stored at the patient monitoring sessions tab for that individual user. So if we click that, we'll see that new session time that I just started has been collected. We also have in the left-hand part of the menu a PM sessions tab. And in the PM sessions, it stores every individual patient that you're participating and you're monitoring, and it'll give you if they have collected any session times. And again, if you remember, CPT code 99457, it only is 20 minutes. So we can go ahead and review these, and the doctor can now go ahead and submit for reimbursement on those codes. You also have the ability to expand and view the details of the remote patient monitoring sessions. You also have the ability to check previous month and run a filter for it. And you can see all your sessions for the previous month. and you can expand and be able to see them all broken down into details. Keep in mind, one of the biggest changes in the RPM model this year is to allow any staff member to participate in patient monitoring. So the doctor or the registered nurse does not have to be that's doing the patient monitoring. It can be any one of their staff members. Besides the patient monitoring sessions, we also have a tab called exceptions. In the exceptions, it will show you every exception that has been done for the individual patients. At a user level, you see it at a user level and with a menu that it focuses on just that individual user. But the exceptions menu stores everyone. So you're able to actually go in and maybe even run a filter that is focusing on a certain expectation you created. So this one here is a blood pressure diastolic between a range of 91 to 99. I can then go in here and see every individual exception that has been triggered and the time that it actually was triggered by and the individual user. I can even run another filter to focus if I just want to see other individual users. But you can also expand it to view it at a glance at an all screen. And here it will just show you other users that are in there. But let's go ahead and drill it down to another individual. And as you can see, as I'm typing it, it automatically will start choosing to filter it by that individual user. So you have all these filters here that you can continue to drill down by a particular a month, day, and a year, a particular rule type or a reading type for all your exceptions. That is a brief description of the PM sessions and the exceptions menu.